Thanks, everybody. I appreciate the incredible interactive discussions that are being had across multiple different disciplines. Really exciting to hear and grateful that everybody's doing that. It's a real pleasure and honor to introduce Chancellor Sam Hawgood. I don't think we need too much introduction, but Sam has played so many roles as a clinician, researcher, and educator and administrator, as division chief of neonatology, dean, and now chancellor. But most importantly, Sam's been a colleague of Mike's for about 40 years, and Sam is an honest-to-God clinician, researcher, educator. I worked side by side with him, 25 years ago, and he's the real deal. So, and it really lends an incredible depthness to what he does, I think, as the leader of our institution. So I just want to turn over to Sam, and really thankful. And as a friend of Mike's for almost 4 decades, I think he'll shed some insight. Thank you.
Thanks, Hunman. It's great to be here and to see so many, I was going to say old friends, I'll just say friends. And I can feel the excitement in the room, so it's just wonderful to see how things have evolved and how the Michael Harrison Symposium is a big part of what will be happening going forward in science and clinical care in pediatric surgery. So I came to UCSF as a postdoc in 1982, and that was just 4 years after Mike Harrison joined the faculty here. And it was just 1 year after he performed the world's first open fetal surgery. It's been a highlight of my career, as Hunman mentioned, to be part of that team that really blazed the field of fetal surgery that is now worldwide. And it's been an incredible privilege for me to work with Mike and Diana and Hunman and the other surgeons that are here to care for literally hundreds of patients who benefited from his innovations in fetal surgery. So thank you, Mike, for the incredible opportunity you provided me when I first arrived and showing me what the word innovation really means. I have to say, though, I was a bit surprised when Mike called me about this symposium a month or so ago, surprised that he'd taken the time to listen to my State of the University address last December, and I hope he's the only one in the room that listened, because you're going to hear it again, and even more surprised that he actually liked it. So he asked me if I would just come and share a few thoughts about this hot-breaking area of artificial intelligence and high-performance computing, and how that might impact our missions across UCSF. I have zero doubt that it's going to have a major impact, but share with you a little bit about how we're preparing the university to be a player in this new world. I'm embarrassed I was introduced to someone who is a true AI computer guru, so I hope he's got his email or something else to attend to while I'm talking here. Because I'm not really going to talk in a technical way. I'm going to really talk more about organizationally how, as Chancellor, I've put a team together to help me think this through. It's no surprise to anyone that technology has had a huge impact already on all of our missions over the last 4 decades. If we think about personal computers, if we think about the internet, if we think about our smartphones, et cetera, all of those things, electronic health records, have already had a huge impact. But I think at the end of 2022, when ChatGPT was first, rumors about it started to circulate, and then it was first released, I think it's, at least to me, we are truly on an inflection point, something that's going to dramatically, not incrementally, but dramatically change the way we approach all of our missions. Now, that said, it's early days. There's a lot of hype. I just finished watching the 2-hour sales pitch that the CEO of NVIDIA did down in San Jose last Monday. If 10% of what he said is true, we are in for a wild ride over the next few years in terms of what the capabilities are going to be. And I think it's up to institutions like us and other major academic institutions to make sure that we explore these tools and draw the power from them, but do it responsibly and make sure that we don't put a foot wrong, particularly in the clinical space, but in all of the different spaces. I called my talk in December, my State of the University talk, where usually I try to cover the waterfront, because if I don't cover the waterfront in the State of the University talk, I get emails to say you didn't mention me, or you didn't mention me, or you forgot this part of the organization. So I really focused it, at least half of it, on what we're doing about AI. And I titled the talk Confluence, because I think what we are at a confluence of human intelligence, where we pretend we actually know what that is, but I think it's even a bigger black box than artificial intelligence. But if you put the two together, this concept of the confluence of human intelligence and artificial intelligence to create what many, including me, call augmented intelligence. So what I'm going to do this morning is just briefly outline some of the steps we've taken since the latter part of 2022 and predominantly throughout 2023 to think in an institutional way, an organized, intentional way about how we can prepare UCSF to make a difference in this space. So in 2023, we had 2 half-day summits where we pulled about 50 people together, predominantly, but not exclusively, from within UCSF. The first summit in April was focused on the application of AI in the clinical space, the healthcare delivery space, and then a second summit later in the year on the discovery science space. And next week, we'll have the third summit focused on the education space. And we've been very focused on next steps. So yes, it's fun to come together and talk about this stuff for a day, but what are we going to do about it? So at the first retreat on healthcare delivery, there was a consensus that we have a tremendous opportunity to leverage and strengthen UCSF's expertise in clinical AI. As usual in these kind of events, I was shocked at how much is already happening. The 1,000 flowers bloom, and you bring people together, and you learn that people are way ahead of me in thinking, which is great. And we have a real potential to deploy it at scale, safely, equitably, and efficiently. It was clear that we would need to create a new structure, a new technology platform for that to happen at scale. There are many organizations around the country that are saying that they're deploying AI, but when you dig deep, there's pilots here and pilots there. And what I'm interested in is thinking institutionally wide as to how we can do something that changes the needle. So we put a tiger team together, and we came up with what we call Versa, which is our AI-enabled platform that I hope many of the clinicians in this room are already using it. But by the end of 2024, I hope all of the clinicians across UCSF are using it. It turns out that I think work that's been done for the last 10 years, while it wasn't necessarily done in order to meet this particular moment, has created some powerful platforms to build on. So our information commons, which is a database that Atul Boot and his team in our Institute for Computational Health Sciences have worked and created, which is basically all of the EPIC, or in our case, APEX, clinical information, structured and unstructured, goes into a common information commons. And on that, in fact, we can leverage the 6 health systems across the University of California wide into a single common database. So UC Davis, UCSF, UCLA, UC Irvine, UC San Diego, UC Riverside. One of the largest academic databases in the country, and one of the most diverse databases in the country, because we span the entire state of California. That's important. The de-identification part is obviously important, and we've had an outside auditor come in and confirmed and certified that that data is appropriately de-identified. And then we have our enterprise data warehouse, which is identifiable data, real-time data. And then we have also created what we call our HIPAC, or UCSF Health Informatics Platform for Advanced Computing, and that was in place as well. And APEX being our electronic record. So what we've layered onto that is what we call Versa, and the Versa came from the word conversation. Clever. The day I was told That's what we're going to call it. I was driving home behind a car that isn't called Versa, so I'm not sure we can copyright it. But we've developed important partnerships with OpenAI, which, for those that don't know, they've just taken a 200,000 square foot lease immediately across 3rd Street. So they're going to be partners. You'll be able to walk to them in 2 minutes later this year. Microsoft, Salesforce, Ambience, and other commercial players to help us build the Versa platform. The importance of it is that we have a private instance of the Microsoft Azure cloud and a private instance of OpenAI at the moment, ChatGPT-4 Plus. And the private instance part is important because it means our data never leaves UCSF. It doesn't go to Microsoft, it doesn't go to OpenAI. So we are controlling it. And again, we've had an outside order to come in to confirm that that is in fact the case. Versa allows our clinicians, administrators, researchers to access large language models and large LLMs as well, while keeping both the model prompts and the data itself in a secure enterprise cloud. There are now more than 1,000 authorized Versa users, and we expect that to expand pretty rapidly. It's easy to become a Versa user. You just basically ask for permission. Last month, we put a requirement in that I'll mention in a minute, that before you are authorized, you have to take an online course on the ethical use of artificial intelligence. And what we have found in the early days, in terms of looking and seeing how people are using it, this is kind of bucketing it into 4 major buckets. People are extracting information. When a patient is referred from elsewhere and you have this enormous chart to go through before you decide what you're going to do, Versa can do that for you very quickly. Knowledge management. We've put all of the nursing training manuals and policies into Versa, all of UCSF's HR policies, and I don't even want to embarrass our institution by telling you how many of those there are. I mean, if you had them in paper, they would be a pile this high. They're all in Versa, so you can do very quick inquiries, some of that. We're loading entire textbooks, and we're in discussions with some of the big medical publishers about loading their entire libraries into Versa so that you can quickly interrogate a question across the medical literature. And then the writing and coding is where we're really focused right now, because as it's not a secret that burnout in the clinical space is a real problem across the country, including at UCSF, where over 50% of our physicians claim they're feeling profound burnout, and it's only getting worse. And when you ask why, it's the friction of doing clinical work that's the problem. It's the documentation, it's the inbox management, et cetera. So we're using Versa to create AI scribes to take over the documentation part, particularly in the outpatient side. And we have about 200 physicians in a pilot now using Ambience. We're testing several different products there, including the one that Epic has built. And inbox management, how much can AI help us either answer directly inquiries that come in or more effectively route them where they need to be routed, and to take that away from the physicians. And then, automated decision support. So they're the major themes that people are working on now, and I'm confident we will see more to come. 2 other important milestones in 2023 were the appointment of Dr. Sarah Murray on your left as our first Chief Health AI Officer, and the appointment of Dr. Julia Adler-Milstein as the founding chief of the Division of Clinical Informatics and Digital Transformation in the Department of Medicine. I highlight this because I think it underscores the point that we are going to treat the introduction of AI into the clinical space as a research tool. Sarah is responsible for evaluating any application so that we've got about a dozen AI applications active in the clinical space right now, and we've already turned 2 of them off because we discovered by evaluating them carefully, they were totally ineffective. In fact, worse than not doing them. So any application has to go through her, goes through a governance committee, and before it goes live in the clinical space, we have to have an evaluation protocol in place and be prepared to turn it off if it doesn't work. So Sarah's focused on that. Julia brings a particular interest, not in the technical side of AI, but in how it can be incorporated into a clinician's workflow, how to make it actually reduce the friction for clinician and make sense for patients. So she brings a sort of a social engineering concept to our work in AI, and I'm particularly excited that they're both nationally recognized, and I'm thrilled that they're part of it. Now, in contrast to the notion that technology can be dehumanizing, there is also the potential that artificial intelligence might, if we deploy it thoughtfully, reduce administrative friction, as I've said, and enable us to recenter the human touch for our patients and address clinical burnout. In order for that to all work, we have to be very careful that it is used in an ethical fashion and that we carefully protect patient privacy. There is a concept that Atul shared with me that he calls democratizing privilege. He's been very public about the fact that he's battling a rare and difficult cancer right now. And in his position, as a privileged physician at a major academic health system, he can access the best at MSK, the best at Dana-Farber, the best at MD Anderson, the best at UPenn, to help him navigate his clinical issue. But many people can't do that. And I think the idea of democratizing privilege is that AI tools may in fact allow people all around the world to have immediate access to the best in the world to help them guide their healthcare. So that concept of scaling privilege or democratizing privilege, whatever the right word you want to use, is important to me and is a focus to make sure we do that. We have adopted the federal government's principles of trustworthy AI and have ongoing evaluation systems in place to make sure that any tool we put in place is indeed trustworthy. As I said last month, we launched an online training in the ethical use of AI, as well as other online trainings such as how to ask the right question, this so-called new field of prompt engineering, when people tell me frequently, as Roberta did earlier, that she asked a question to AI and it gave back garbage. And I said, you put garbage in, you'll get garbage back. There's a real science into asking the right question, so-called prompt engineers. I saw a company advertising for prompt engineers recently, and the starting salary was $400,000. So it's a hot field for those of you who are looking for a change of pace. So our second retreat in July focused on the application of AI in the discovery sciences and precision medicine. Again, incredible enthusiasm around how new AI tools can revolutionize discovery science by allowing us to rapidly analyze large data sets, uncover hidden patterns, and accelerate the process of hypothesis generation and experimentation. Of course, one need not look further than the 2020 release of the AI model AlphaFold 2 that was done by DeepMind, which is a subsidiary of Google, to understand the promise of AI. Trained on large publicly available databases, all of the current databases of protein structure done by painstaking X-ray crystallography or cryo-EM, AlphaFold 2 accurately predicts protein structure directly from the protein sequence at a high fidelity, something approaching 90%. And that a fundamental scientific breakthrough that has changed the way our discovery science labs work. And it's widely deployed across UCSF, but of course, across the world. So at the retreat, We discussed many exciting AI-enabled projects underway at UCSF, as well as future opportunities. We explored how generative AI-enabled advances could focus on understanding and writing the language of biology across biologic scales from atoms to organs. Such an understanding in the chemical space, for instance, could radically advance the discovery of precision drugs. In the protein space, it could advance our ability to program proteins and cells for new therapeutic functions. And that is in fact happening today in many labs at UCSF, whether it's redesigning through AI-enabled synthetic biology, cellular function, the next generation of CAR T cells, redesigning or designing de novo proteins that don't exist in nature, designing antibodies computationally and then proving it experimentally. All of that is happening today. But it was very clear from the retreat that if we wanted to be a leader in this space, we needed to further enhance our high-performance computing capabilities. Today, what we have is a high-performance compute cluster called Winton. Those of you who use it, I know it's not working perfectly, so no need to remind me of that. But it's not enough. And this slide says this new high-performance computing cluster that's approval pending. I approved it 2 weeks ago, and that will dramatically improve our high-performance compute. It's a sufficiently large, it doesn't compete with OpenAI or Oracle or Microsoft, of course. It's many orders of magnitude below that. But I think it will deal with 95 to 98% of all the high-performance computing that is needed at UCSF. We won't have it on the campus because we don't have a facility that has the cooling and electrical requirements, so we'll co-locate it in a commercially run data center within a few miles of here. And that should come online in 2024 and put us in a great position. Our researchers can also use Versa and all the AI apps. Right now we have OpenAI as the app, but it's not exclusive. We'll be loading the Google app and the Facebook app in the next few months. So there'll be a range of tools that our researchers can use in Versa, as well as our clinicians. Now, a common theme in both retreats was the risk of potential bias or malicious misuse inherent in these large new data models. So Dr. Hal Collard, who's our Vice Chancellor for Research, and Dr. Ida Sim, who's our Chief Research Informatics Officer in the Office of Research, are leading the development of new processes for the scientific and ethical evaluation of any large language models that we put in place. In November, in fact, Keith Yamamoto, our special advisor to the Chancellor, or my special advisor for science policy and strategy, led a workshop called Towards Algorithmic Justice in Precision Medicine. Folks from the NIH and FDA and others were there. And that workshop together brought a group from a wide range of diverse backgrounds from around the country to help us consider how systematic flaws in data collection, data sets or AI tools that can potentially perpetuate structural inequalities in the health system or in science in general. And there are a number of next steps that are coming out of that retreat. There's no question that AI will have an impact on our education mission as well. And as I said, next week, we'll hold a third retreat on that subject led by Executive Vice Chancellor and Provost Catherine Lucy. And it's not hard to imagine how AI-driven immersive simulation and personalized learning experiences may reshape how we educate clinicians and scientists alike in a way that combines both knowledge, meaning, and purpose in novel ways. We also need to consider how our own workforce upskilling is going to be needed for us to take advantage of these new tools, whether they're nurses on the unit or HR administrators or clinicians. Most of us were not trained in these tools, and for us to take advantage of them effectively, we're going to have a broad education workforce upskilling that is underway as well. Now, we've started new education offerings that will train the next generation. Last fall, we welcomed the inaugural graduate class in the joint UC Berkeley UCSF Computational Precision Health Program. That is a program designed to bring in PhD students or MD PhD students who are interested in working at the interface between clinical medicine and AI. It has a substantial investment from a philanthropist, and one of her ultimatums to get the gift is that we figure out how to have joint tenured positions between UCSF and Berkeley, something that I've worked on for 20 years. We got it done in 3 months. We've already recruited the first 6 faculty to this joint program. The first 3 came from MIT and are incredibly capable individuals. So I'm excited about that. The first class has been enrolled, and it's going extraordinarily well. And we're just waiting on final approval by the Academic Senate for the School of Pharmacy to launch a master's in artificial intelligence and computational drug discovery and development. And so I think we'll see an upswelling of various educational areas. I'm almost finished. Beyond our missions of research, healthcare, and education, we're also exploring the potential benefits of implementing AI in our what I call back of the house operations. We've already used VersaChat, as I mentioned, to make the massive amount of information contained in our human resource policies and our nursing training documents more easily accessible. And on a weekly basis, we're loading more and more material in there just to make the place work better. And while that's not going to be as visible to most people, I'm particularly excited about that because I think it is a potential game changer if we do it correctly, just to, again, reduce the friction of getting work done on the campus. The health system is using Versa already to better forecast, for instance, bed availability and patient census, and we're seeing a big improvement in length of stay and patient flow because of these tools that are running behind the scenes that most of you are not aware of, but are enabling us to just do things better and more accurately predictive. So this field is moving incredibly fast. Every academic institution in the country is talking like I'm talking now, but I'm committed to making UCSF the leading AI-informed academic health system in the country. And to that end, I meet on a monthly basis with the Tiger team who update me on where we are. And we've developed, I don't expect you to read this, but just to show that we have a detailed roadmap for the rollout of AI across all of our missions. This takes us through to the end of this year, but you can see, we have GPT-4 Turbo in now. We're loading Llama. We're loading the Google tool right now. We're focused on governance and appropriate equity, et cetera, and there's just a lot happening that's very exciting. So thank you for having me here today. I hope that gives you a glimpse of what we're up to on the administrative side. I wish I could join you in looking after some patients every now and again, but I enjoy what, people call me a suit. I do wear a suit now. But it's been super fun to embark on this new journey, which I think truly is going to change the way we think about everything we do, and it's going to happen very fast. So thank you for listening.